You may not see the tick. You will not feel the bite. The bullseye rash may not appear. Early symptoms may be mild. Long-term symptoms may be difficult to diagnose. Lyme disease is often called a silent epidemic. Patients and physicians often struggle to identify exactly what is happening. The effects on the body can be systemic. Sometimes the effects on the body are long-term. Lyme disease is the most common and fastest growing vector-borne disease in the United States. Risk areas are expanding. As the human population grows, we develop in tick-infested habitats and the climate changes. As the global temperature increases by 2 degrees Celsius, it is estimated that Lyme disease will increase by 21%. Inside of the human host, there are many aspects of Lyme disease that make it difficult for the immune system to respond. Our immune system is not enough. In order to stop the spread and treat the infection, researchers follow the bacteria from the environment all the way to post-treatment in human patients. There are things you can do to help yourself and your loved ones. I'm Wanda Frazier. This is Your Body and You. Data for Lyme disease is a little confusing. There are two sets of numbers, the official reported numbers and the estimated numbers. The CDC and local agencies will report both. Since 1991, Lyme disease has been a reportable condition to the CDC. In recent years, official data shows about 90,000 cases of Lyme disease each year. However, since 1991, the CDC has updated the reporting criteria for Lyme disease 6 times. On this graph, you will see different colors representing the differing criteria over the years. The latest update was in 2022. Before 2022, in high-risk areas, the reporting criteria posed some delays. Physicians needed to start treatment as soon as possible, and environmental hotspots needed attention. To speed efforts along, the CDC updated the reporting criteria based on laboratory criteria alone, without the extra burden of obtaining clinical criteria. So the official numbers after 2022 will reflect the new surveillance criteria. However, physicians often treat patients based on clinical findings alone, such as symptoms and recent tick exposure. Waiting for laboratory data may also delay care. Also, Lyme disease may be severely underreported due to vague symptoms with an unidentified cause. So the CDC and local agencies will calculate a separate number based on commercial insurance claims data, treatment, and exposure. This is the estimated case number. I've seen estimated case numbers that range from 476,000 to 620,000, much higher than formally confirmed reported cases. In addition, some healthcare systems have partnered to share Lyme disease electronic health records in high-incidence states, such as Maine, Massachusetts, Pennsylvania, and Wisconsin. The CDC is setting up platforms to incorporate this data into national Lyme disease surveillance. I have not seen a rollout date. However, even taking into account the updated reporting criteria and estimates, the overall consensus is that Lyme disease is spreading about 5% each year, just as other tick-hosted illnesses and the ticks themselves are spreading. This map shows cases based on county of residence. The Northeast, Mid-Atlantic, and Upper Midwest suffer the most from Lyme disease. So New York, Pennsylvania, Massachusetts, New Jersey, Wisconsin, Connecticut, Minnesota, Maine, Maryland, and Virginia. The risk is higher for children ages 3 to 14 and adults over 50, probably due to increased outdoor activity. Lyme disease is a bacterial infection from the Borrelia family. In the United States, the majority of cases are from the species Borrelia burgdorferi. In the upper Midwest, Borrelia mayonii also causes Lyme disease. Lyme comes from a town in Connecticut where an outbreak occurred almost 50 years ago. In Europe and Asia, Lyme disease is a different species. These bacteria are spirochetes that burrow into tissue. The bacteria are zoonotic and can be traced through the life of the black-legged tick or deer tick. Up to 50% of these ticks carry Lyme disease. They are arachnids like spiders. The black-legged tick is considered a three-host tick, feeding at all three stages of life. It can transmit Lyme disease to humans at all three stages. The eggs of the tick are in the ground. In the spring, the eggs hatch into uninfected, six-legged larvae, less than 1 millimeter in size. So the tick can live in an outdoor area above 34 degrees Fahrenheit. So forest, a park, or even your yard. Most Lyme disease cases are reported in summer months. The larvae feed on small animals such as birds, chipmunks, and mice, where they may pick up the bacteria. The principal vector for the bacteria is the white-footed mouse. Once infected, the bacteria colonize in the gut of the tick. Now the tick will carry the bacteria for life. The tick larvae fall to the ground and overwinter. The next spring, the larvae molt into nymphs, which have 8 legs and are about the size of a poppy seed. The nymphs feed on humans, dogs, and other small animals. People are usually infected by nymphs since they are tiny and difficult to detect. In this photo, the nymph tick is on the right. In the fall, the nymphs molt again into adults about the size of a sesame seed. The adult female ticks are reddish-orange with a brown or black shield on their back. Adult males are dark brown. Adult ticks then feed on large animals such as humans, deer, and dogs. The white-tailed deer is considered the principal host for the tick. The deer are not hosts for the bacteria, just the tick. The ticks mate, fall to the ground, lay eggs, and die. The life cycle is about 2 to 3 years. Ticks feed on blood. Again, ticks can infect humans at all 3 stages of life. They climb to the tips of grass and brush and use their front legs to reach out and grasp a passing host. The process is called questing. On the body, the tick travels to dark, hidden areas such as armpits, the navel, and the scalp. The tick emits an analgesic when they bite, so you don't feel it. Then they use hardened saliva to stay attached. Lyme disease is transmitted 24 to 48 hours after attachment. Once the bacteria enters the skin, it progresses through 3 stages of infection. At the initial infection, the bacteria uses tick proteins to disable the human immune system response. Early in the infection stage, it can change surface proteins to evade the immune system. Initially, the bacteria proliferate at the skin. Between 70 to 80% of patients develop a red or bluish-red circular or oval rash called erythema migrans. It may feel warm to the touch, but generally there are no other symptoms. In about 70 to 80% of cases, the rash clears in the middle to show a bull's eye rash. As the bacteria multiply locally, between 50 to 75% of patients may experience flu-like symptoms such as fatigue, fever, chills, headaches, and swollen lymph nodes. No respiratory symptoms will occur. The initial stage of infection can last from a few days to a month. At some point, the bacteria slip through the junctions in the lining of blood vessels, use surface proteins to hook onto blood vessel linings, and slowly circulate. Dissemination is not fast, so problems develop over time. It can disrupt the lymph node's ability to develop long-term memory immune response. It can hide in cells with limited immune surveillance, such as nervous system, joints, and tendons. Even under attack, it can go dormant and create a biofilm as protection against antibiotics and immune cells. At some point, the bacteria may trigger an immune response. Flu-like symptoms and more circular rashes may appear along with vision problems. In less than half of patients, the nervous system is affected, Lyme neuroborreliosis, causing facial palsy, neck stiffness, pain in the limbs, or pain shooting from the spine. Lyme carditis can develop in less than 10% of cases. Heart block can also occur, where electrical signals between the upper and lower chambers are disrupted. This stage can last from a few weeks to months. Something to consider, there are many different strains of the bacteria inside the human host. The host immune system will respond to the most prevalent strain, allowing the less common strains to proliferate. Our immune system alone is not enough to prevent Lyme disease. Without treatment, the infection enters the late disseminated stage. Symptoms may include those mentioned previously. About 60% of patients experience severe arthritis, along with numbness and tingling. The majority of these patients experience cognitive problems termed brain fog. Patients may suffer meningitis, encephalitis, encephalopathy, peripheral neuropathy, and stroke-like symptoms. This stage can last months or years. The heart can experience fatal heart arrhythmias. However, death from Lyme disease is extremely rare, fewer than 1 per year. I would not be surprised if further research connects more complications and unexpected deaths to a history of Lyme disease. We'll see how this progresses. Even with treatment, about 20% of patients experience chronic Lyme disease, CLD. Late-stage symptoms become difficult to treat and last at least 6 months. These include cognitive problems, neurological problems, and heart problems. Keep in mind, humans don't pass along the bacteria to each other. There is some debate within the medical community about the effects of Lyme disease on a fetus during pregnancy. Pregnant women can be treated for Lyme disease with antibiotics, excluding doxycycline. For diagnostics, physicians use a combination of physical exams, history of exposure, two-tiered blood antibody tests, spinal tap or joint fluid analysis, and sometimes an EKG. The rash alone is enough for a physician to diagnose Lyme disease. However, most patients never see the tick and never notice a rash. The first few weeks, a patient may not make enough antibodies to test positive. So with tick exposure or symptoms, a physician may treat the infection anyway as a precaution. After 4 to 6 weeks, FDA-cleared blood tests for Lyme disease are two-stage antibody test, the ELISA test, and or the Western blot test. However, diagnostics for Lyme disease can be inaccurate up to 50% of the time due to time testing, comorbidities, autoimmune issues, strain variations, and past exposure. For nervous system symptoms, physicians may schedule a spinal tap, called a lumbar puncture, or arthrocentesis, a joint aspiration, to look for antibodies or bacteria DNA. For heart concerns, an electrocardiogram, EKG, may be recommended. Long after treatment, antibodies may remain in the body, so a patient may still test positive. However, even with antibodies, a patient may become reinfected with Lyme disease more than once. A warning: this tick can be a vector for several diseases. Physicians often check for co-infections such as anaplasmosis, babesiosis, Powassan virus disease, and heart tick relapsing fever. Treatment during early stages involves a 10 to 14 day course of oral antibiotics. Doxycycline, amoxicillin, or cenfuroxime acetal. Side effects include Herxheimer reaction or diarrhea. Early in the disease, patients usually recover completely. For patients experiencing heart or nervous system effects, treatment involves oral or IV antibiotics for 28 days to several weeks. Treatment for joint pain includes NSAIDs. Supportive care includes physical therapy for joint mobility and targeted treatment for cognitive or sleep problems. Even with treatment, between 14 to 20% of patients may still develop post-treatment Lyme disease, PTLD. That includes fatigue, pain, sleep disturbance, depression, and cognitive problems. PTLD treatment is individualized. About 10% of patients will experience antibiotic refractory late Lyme arthritis. The bacteria may be dead, but their fragments may remain to cause an immune response. Currently, there are no FDA-approved vaccines to prevent Lyme disease. Limerix was approved in 1998. It was 78 to 80% effective. However, GlaxoSmithKline removed it from the market in 2022 due to declining sales. Currently, Valneva and Pfizer have VLA15, aka LB6B, aka Valor, in phase 3 trials. So far, it has shown over 70% efficacy. Moderna is in the Academy trials for mRNA vaccines, mRNA 1975, mRNA 1982. Most current prevention practices for Lyme disease are environmental. Land management suggestions to prevent Lyme disease are a little confusing. The environmental community suggests that an ecologically biodiverse community does reduce the risk of Lyme disease. Predators who eat Lyme ticks include opossums, ground foraging birds, bats, some small mammals, certain lizards, and amphibians, some ants, beetles, and spiders. However, these animals may also transport ticks, so approach this list with caution. Snakes and foxes will prey on white-footed mice. However, deforestation seems to increase the prevalence of Lyme disease. Landscape managers will suggest to keep your yard free of high grass, clutter, and plants that attract carrier species such as deer. A 3-foot wide barrier of wood chips or gravel between lawns and wooded areas can help. Bait boxes and tick tubes with nesting materials that contain acaricides such as permethrin enable mice to build nests that will kill the ticks. Some researchers are testing procedures to genetically immunize mice. Also, there is an app for everything. The Tick app allows users to identify where ticks have been reported, learn how to identify ticks, and protect themselves. To prevent the tick from attaching, use EPA-approved insect repellent containing DEET, picaridin, oil of lemon eucalyptus, and permethrin, and IR3535. In woods or long grass, wear long sleeve shirts and pants treated with 0.5% permethrin. Tie up or cover long hair. Generally, the tick must be attached for 24 to 48 hours before transmitting Lyme disease. After coming indoors, the CDC recommends showering within 2 hours to wash off unattached ticks. Wash your hair, then perform a tick check. Clothes should be dried for 10 minutes on high heat to kill ticks. If the clothes are damp or must be washed first, wash in hot water and then dry completely in a hot dryer. Cold or medium temperature water will not kill ticks. Check all gear before stowing and check pets. Attached ticks must be removed promptly and correctly. Timing is crucial. Do not grasp the tick by the body. The tick may vomit into your skin. Use sharp-pointed tweezers and grasp the tick by the head and pull straight out. These ticks are small, so using a tick key may make it easier. Then clean the area with alcohol or soap and water. Contact your physician for further suggestions. If you save the tick in alcohol or tape, some agencies can test the tick. Check with your local health department. In high-risk areas, sometimes physicians will prescribe a single dose of doxycycline immediately after exposure to lower the risk of infection. Most host animals for Lyme disease are carriers but never develop symptoms, except for humans, dogs, and horses. Sometimes cows, rarely cats. Please talk with your veterinarian about risk, testing, and treatment for non-human animals. The call to action for Lyme disease is to rapidly expand federal funding for further research and environmental surveillance. Funding remains disproportionately low compared to other less common diseases. The Center for Lyme Action provides congressional requests and stresses better diagnostics and treatment. The CLA is urging Congress to support FY27 Lyme and tick-borne disease funding. The Global Lyme Alliance provides research funding and patient support. So be diligent, check on your people and your pets. Please like, subscribe, or share this video. For decades, I've worked in biological science, public health, and health education. I'm concerned about the public's confusion around health information and the communication blocks between physicians and their patients. Your contribution to my Patreon page will help me to continue to bridge those gaps. Share something useful because none of us have time for nonsense right now. Stay safe. I'm Wanda Frazier. This is Your Body and You.